Thank you for joining me on this quick virtual workshop presentation on mood, recharge, and sleep, tips for teens. I am Dr. Pratt. I'm a board-certified clinical health psychologist with your AdventHealth for Children's Healthy Weight and Wellness program. Today, we're going to talk about the teen brain and the different functions of your brain, as well as mood and feelings and how your feelings affect your body. Then we will talk about different ways to recharge and deal with emotions and feelings in positive ways. We will then wrap up talking about how to get good and restful sleep. Although our brain goes through a lot of development and growth after we are born and through our childhood, did you know that during our teenage years, our brain is actually rewiring? It's kind of like a house being remodeled. New and specialized connections are being made, and our brain continues going through this remodeling and redevelopment process through our teen years, up until about the age of 25. What exactly does our brain do? There are many different functions of our brain. Our brain controls our thinking, our perceptions, our feelings and emotions, our behaviors, our body's physical activities, and it also gives us feedback about our environment or our surroundings. There are many different chemicals or neurotransmitters that help with signaling for different parts of the brain to communicate. The main part of the brain that controls our emotional responses is called the hypothalamus. The hypothalamus also controls our body temperature, blood pressure, thirst, appetite, and our sleep patterns. These are all very important functions that can affect our health and wellness, especially during our teen years. Now we're going to talk about our mood, feelings, and different ways to manage them. The first step is very important, and that is identifying our feelings. We can experience different emotions at different times. Our feelings can be positive, negative, or neutral, and there are many times we can experience different feelings all at once or have mixed emotions. Some examples of feelings are fear, anger, happiness, sadness, love, and excitement, amongst many other emotions. It is important to accept your feelings once you identify them, and it is okay to feel what you are feeling. All feelings can be normal. We also have to think of ways to deal or express our feelings in a positive or productive way. The ways that we do this are called coping strategies. Some examples of effective coping strategies are talking to someone we trust, like a friend, a family member, trusted adult, or counselor, maybe crying it out, laughing, taking time for ourselves to calm down by ourselves, writing in a journal, singing, listening or playing music, taking a walk, taking deep breaths or meditating, drawing, painting, or doing something creative. Sometimes our feelings and life situations can stress us out. What are some things that stress you out? Think about things in your life that sometimes create stress. A recent survey by the American Psychological Association found that some of the most common sources of stress for teens are school, such as grades and tests, deciding in college or what to do after high school, and money or family finances. There are many other things that can create stress for you, such as friends, family and family problems, social events, and life in general. Teens also reported having more problems falling asleep, overeating or eating more junk food, and skipping meals in response to stress. All of these stressful situations can be normal in life, and all the feelings you may experience from these stressful events are also normal. Here is a diagram of what stress can do to our body and health. In the short term, we may feel more worried, nervous, or anxious. Our heart may begin to race or beat faster. We may breathe quicker, our stomach may ache or feel uneasy, and our skin may become sweaty or oily. Our muscles may also tense up or ache. In the long term, we may experience more headaches or migraines, mental health issues such as anxiety or depression, as well as heart problems such as high blood pressure, problems breathing, or hyperventilating. We can also experience acne or hair loss and be at higher risk for diabetes and obesity. So now that we've talked a little bit about stress and how it may affect our mind, body, and health, it is important to take time to recharge and take care of ourselves so that we can deal with the stress we experience in our lives in a healthy way. It is something we also call self-care. So what is self-care? It is anything that makes you happy and supports your physical, mental, and emotional health. Recharge and self-care activities can help you improve your mindset and outlook on life. Self-care is important because of all of the stressful things you experience in life, and because as a teen, you are learning to become more independent in figuring out the next steps in life, and with that comes more responsibility and pressure. You're also going through many hormonal and mood changes in your teen years, while your brain is still developing until about the age of 25. Self-care will help you build resilience or strength to address all of these life changes, challenges, and frustrations, even the normal and not so normal ones. These are things that may stress you out as a teen and as you get older, and that is why self-care is important. Some examples of self-care practices involve physical activities, mental or emotional activities, and creative and spiritual activities. Some physical activities may include exercising, such as taking a walk or going to the gym, taking a warm bath, or taking a nap. Some mental or emotional self-care activities can be playing video games, watching a movie or video, spending time in nature like hiking or gardening, and spending time with friends. Some examples of creative and spiritual self-care activities include writing, drawing, listening to music, reading, cooking, listening to podcasts, praying, meditating, reading positive affirmations, or taking moments to think about what you're grateful for, moments of gratitude. Now that we've talked about self-care, we will move on to the important topic of sleep, because if you are not sleeping well, that will also have a negative effect on your mood, how you deal with stress, your health and well-being, as well as your academic and athletic performance. So how many hours of sleep should you get every night as a teen? Teens need at least 9 to 10 hours of restful, uninterrupted sleep per night. But recent studies show very few teens, only about 15%, get that much sleep. What are some of the side effects of poor sleep or sleep deprivation? As far as your mood, you can become more moody and irritable, and in the long term, be more at risk for anxiety and depression. In terms of your physical health and development as a teen especially, in the short term, it may be harder for your immune system to fight off colds and viruses. Your body may have more problems regulating hormones that can affect your appetite, food cravings, and weight. Also, poor sleep can negatively affect all of your brain development. Remember all that rewiring that's being done during your teen years? It can also affect your muscle development and final growth spurts that occur during your teen years. In the long run, sleep deprivation or sleep loss can put you at higher risk for obesity, diabetes, high blood pressure, and heart disease. In school, poor sleep can result in problems with thinking, attention, memory, and problem-solving skills, which can end up lowering your grades and test scores over time. When playing sports or doing exercise, you may respond more slowly and may have less power or strength. And in the long term, you're at greater risk for muscle and bone injuries. So now think about what is your actual bedtime routine and how much sleep you normally get. Is your routine one that allows you to get good rest and at least 9 hours of restful sleep? Your bedtime routine should include relaxing rituals or activities, a good sleep environment in your bedroom, and no distractions. Here are some more specific tips for a good sleep routine. One of the most important things to do is to set a reasonable bed and wake-up time that will allow you to get at least 9 hours of uninterrupted sleep per night. On weekends, try not to go beyond 2 hours of your normal weekday bed and wake-up times so you don't throw your body too off schedule. We can't fully make up for weekday sleep loss over our weekends. Another important tip is to turn off all screens and electronics such as cell phones, laptops, tablets, TV, and video games at least 30 to 60 minutes before bedtime to get your mind and body prepared to relax for sleep. Also, do the same simple 1 to 3 relaxing activities at bedtime, such as putting on comfortable pajamas, taking a warm bath, listening to relaxing music, or reading a book. You also want to create a soothing sleep environment in your bedroom, which should be comfortable, cool, dark, and quiet. Avoid daytime naps or limit them to occasional 20 to 30-minute naps in the early afternoon. Definitely do not take naps in the late afternoon or evening because that may make you less sleepy at your normal bedtime. It is also helpful to be active and get some vigorous exercise daily and early in the morning if possible with some sunlight. And avoid exercising too close to bedtime because that can make you less sleepy at bedtime. Another tip is to keep your bed for sleep. Avoid other activities such as eating, watching TV, doing homework or schoolwork in your bed because this may confuse your body about what activity you're going to do when it comes to bedtime. This is called a sleep association, and we want our body to associate bed with sleep and not the other activities. Finally, avoid big meals before bedtime and avoid caffeine, especially in the afternoons and evenings. Finally, here are a few true-false statements to review everything we covered today. Number 1, the brain stops developing at age 25. False. As we learned today, your teen brain continues developing until about the age of 25. Number 2, taking a walk or doing exercise is a good way to deal with stress or a bad mood. True. These are some good coping strategies and self-care activities to deal with stress, strong or difficult feelings, and also ways to recharge or improve your mindset and outlook. 3, stress does not affect our body or health. False. Stress can affect our feelings, emotions, our outlook on life, our behaviors, as well as different parts of our body and our health. Number 4, teens only need 7 hours of sleep per night. False. As we discovered today, teens actually need about 9 hours of restful, uninterrupted sleep to stay healthy, feel well, and maintain a healthy weight or get to a healthier weight. Good sleep can help improve your mood, your health, and your academic and athletic performance. Number 5, sleep loss can make you moodier and make it harder to think and remember things. True. Sleep loss or deprivation, less than 9 hours of sleep per night as a teen, can cause poorer thinking, attention, and memory skills, which can lower your school grades and also make exercise or playing sports more difficult. Thank you for joining me in this presentation for teens on mood, recharge, and sleep. If you have any questions, you can contact me at the email or phone number listed on this final slide.